This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
Hi, Wisconsin. Governor Tony Evers here.
And I'm Lieutenant Governor Mandela Barnes.
We wanted to take a moment today to thank you for wearing a face covering or a mask whenever you are out and about.
Your good work can save lives. As we know, face coverings and masks are effective tools to stop the spread of COVID-19.
That's right. And we wanted to share some tips to make wearing your mask even better. First of all, wear your mask whenever you are indoors in a space that is not your own home.
Second, wear a mask anytime you're around others who you don't share a home or a living unit with.
Next, always wash your hands before and after putting on or taking off your mask.
And remember, not to touch it or move it around without washing your hands.
And finally, a mask or face covering is not a substitute for physical distancing. Please continue to maintain 6 feet of distance between you and anyone who is not a member of your household.
These steps are critical to our efforts to box in this virus and keep Wisconsinites safe. So mask up, Wisconsin.
And let's get through this together.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please remain muted until it's time to ask your question. And if you're on the phone and are able to do so, please use *6 to mute and unmute. Joining us for today's media briefing are Governor Tony Evers and DHS Deputy Secretary Julie Willems Van Dijk. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Thank you. Good afternoon, and thank you all for joining us. We estimated our efforts in the spring with the Safer at Home order. It could have saved between 300 and 1,400 Wisconsin lives. And unfortunately, as you know, the Wisconsin Supreme Court struck down that order, severely hamstringing our ability to respond to this pandemic with the tools supported by science and public health experts. But that does not mean those efforts didn't help people keep people safe. So that's why we must get back to the strategy and back to the basics of fighting this virus, and that starts at home. On Tuesday night, I delivered a statewide address announcing that I signed Executive Order 94, calling on Wisconsinites to stay home to save lives. That order advises Wisconsinites to stay home, limit contact to only those you live with, and encourage your friends and family to gather virtually rather than at each other's homes. Cancel gatherings and parties and plan for virtual holiday celebrations instead. Support local businesses through curbside pickup, delivery, and online. Avoid any unnecessary travel and limit trips out to the essentials like grocery shopping and getting tested. And if you do have to go out, always wear a mask and stay 6 feet away from others. If you are an employer, the order recommends allowing employees to work from home whenever possible. Take extra precautions to limit the number of people in your store or office or facility and help protect both workers and customers. The science is clear, folks. If we don't act now and if we don't treat this pandemic like the urgent crisis it is, Wisconsin could lose thousands more of our friends, family, loved ones, and fellow Wisconsinites by the end of the year. And I want to be clear, there are no mild infections of COVID-19. Sure, there may be mild symptoms, or you might even be asymptomatic, but we still have a lot to learn about the long-term impacts of COVID-19 on our health. Many patients report decreased quality of life after COVID, and many have longer-term issues with shortness of breath and fatigue. But the consequences of COVID-19 go beyond just having effects on the physical health. It can have effects on mental health too. Many people who test positive for COVID-19 experience a new or worsening mental health, including anxiety and depression. A study recently published in the Lancet Psychiatry Journal showed people who tested positive for 19 are twice as likely to have a new mental health diagnosis in the 90 days after testing positive. Frankly, folks, it's not just worth it. Your health, your safety, and the health and safety of your neighbors and friends is just not worth the risk. We also don't know the long-term impacts of COVID-19 on our communities or our economy. We've put our federal CARES Act dollars to good use across our state, supporting our farmers and our workers, businesses, kids, and families. We've supplied PPE and sanitizing supplies to local communities, helped more than 12,000 households pay rent, assisted more than 26,000 small businesses keep the lights on and the doors open. And today we announced an additional $10 million investment in our food security initiative. This announcement brings the total investment in Wisconsin's agricultural and food industries to $75 million and will award $5 million each to the Hunger Task Force and Feeding Wisconsin so that they can continue their good work of keeping Wisconsin families fed. Also, through our CARES funds, we expanded statewide testing and contact tracing efforts with 71 new testing sites that will now be available in 56 counties and 7 tribal nations, because everyone who needs a test should get a test. If you think you might have been exposed to COVID-19 or start to experience symptoms, please go get tested. And then make sure you isolate away from others and stay at home while you're waiting for your results. Even if you do test negative for COVID-19, it's important to remember that just because you test negative today doesn't guarantee a negative test tomorrow. And we know many infections are asymptomatic, so the safest thing to do is stay home. We have a long road ahead of us, and staying home to save lives is one of the best ways you can help the farmers, the workers, the families, healthcare systems, and small businesses that need our help now more than ever. You can also help by calling your congressperson and asking them to provide additional support and resources for our state's response to this virus, because the bottom line is that the federal CARES dollars expire December 31st. And we know there's a whole lot more we have to do to rebuild and recover, and we can't do it alone. This year has brought us extraordinarily difficult challenges, but I know that Wisconsinites are resilient. Whether rebuilding a community after a tornado, sandbagging during a flood, or digging out with your neighbor after a snowstorm, Wisconsinites know how to dig in and take on the big fights together. And this health emergency is no different. Let's count on each other, Wisconsin, and let's move forward with one goal: putting COVID-19 behind us. Now I'll turn things over to DHS Deputy Secretary Julie Willems Van Dijk. Julie?
Thank you, Governor. And good afternoon, and thank you for joining us. COVID-19 is everywhere in our state. It is bad everywhere, and it's getting worse everywhere. It is straining hospitals, and people are dying. As of last week, every county in Wisconsin was at a very high disease activity level. This week, we have added a new category, critically high, which indicates case burden of over 1,000 cases for every 100,000 residents, a level nearly 3 times higher than the very high category. 65 of Wisconsin's counties now meet that threshold, with the other 7 still at very high. As of yesterday, every county in Wisconsin has reported at least 1 death from COVID-19. Our hospitals are strained. We have set a new record for the number of hospitalized COVID-19 patients every day this month. Statewide, only 8% of ICU beds are available. Today, we added 7,497 more confirmed cases of COVID-19. That brings our total to 293,388. Today, we have lost 58 more friends and neighbors to this virus. 2,515 Wisconsinites have now lost their lives to COVID-19, and our hearts go out to their loved ones. We owe it to them, and we owe it to ourselves to take every action we can to stop the spread, just as the governor said, to wear a mask, to stay home, to save lives. It's tiring, I know, but we are in a crisis as a state. COVID-19 isn't someone else's problem. It's ours. At the beginning of this pandemic, I know a lot of us looked at New York City in disbelief. We worried for the people who live there, and we were also really grateful it wasn't as bad here in Wisconsin. Well, here in Wisconsin, COVID-19 is that bad now and worse, and we must take action. Our current 7-day average of new cases is 6,209. Back in April, when the virus was at its worst in New York City, their highest 7-day average of cases was 5,292. We are 1,000 cases more a day higher than New York City was. And Wisconsin's daily average is not only that much higher, but it's higher, and our population is smaller by 2.5 million people. This spring, ambulance sirens ran nonstop in the streets of New York. The reality of COVID-19 was unavoidable. With so many people living in such close proximity, you could see the devastation the virus was creating in the city. The residents of our state are more spread out, so it's easier to miss the crisis. But this virus and the death it brings with it are everywhere in this state. COVID-19, its spread and the strain it's putting on our hospitals endangers everyone in Wisconsin. But as I close, let me share this. One of the things I love most about our state is how neighbors care about neighbors. How when you get a flat tire, multiple people stop to help. How we volunteer for everything from coaching your child's soccer team to helping out at the food pantry to serving on your local nonprofit board. That caring spirit and that civic pride is what we need now to get to the other side of this pandemic. We're getting closer to vaccine, so let's pull together for the next 2 to 3 months to do what it takes. Please wash your hands. Stay at home unless it's absolutely essential for you to go out. And when you do go out, wear a mask and keep 6 feet apart from other people. And wash your hands. Let's do it for each other, Wisconsin.
Thank you. We'll now take your questions. A reminder to maintain audio quality. Keep phones on mute until it's time to ask your question. Also, we have a hard out at 2:15 today, so please 1 question per reporter in order to accommodate everyone. And we'll begin this afternoon with Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking the question. I don't know what the I believe we had yesterday 11 patients at the alternate care facility. I'm not sure what the census is as of today, but hospitals, as of course you said, are filling up and in many cases backing up. It does seem that elsewhere in the state, patients are reluctant, understandably, to transfer to the West Dallas facility. And also long-term care patients are backing up in hospitals instead of going back to long-term care or going to long-term care, in part because of shortages of staff or, in some cases, temporary lockdowns at facilities. So my question is, what specifically can any of you tell us about whether there are plans to open up other alternate care facilities for COVID patients elsewhere around the state, B, same but for non-COVID patients around the state, and or C, open some kind of field hospital equivalent that would take long-term care patients around the state. And if there are no plans in that direction, is there a reason that this is not seen as a necessity or priority? Thank you.
Well, let me begin with responding to that, Eric. What I want to say, first of all, is before we talk about anything related to surge planning, we need to go back to how we stop the patients from coming to the hospital in the first place. And so let's not forget that it's on each of us to take action to plateau and decrease the spread of the disease, which will decrease the source of this surge in the first place. But recognizing we already have a lot of infected people and we need to continue to walk forward arm in arm with our healthcare partners on this, we're taking a number of steps to work together on the surge. What we have heard consistently from our hospitals is the biggest issue is staff. They have beds, they don't have staff, and that is true in long-term care, and that is true in hospitals. Part of the reason they don't have staff is their staff are sick or are quarantining. And so we've taken action to look at how we can safely bring people who are in quarantine back to healthcare work with appropriate testing and PPE. We have worked with health systems across the state to make requests to FEMA to bring in additional staff in the state. We are working with long-term care on ways to infuse money into our long-term care facilities to assist them with opening COVID-19 wings and also to assist them with their staffing issue. We're working on a number of initiatives to bring further nursing assistance into the state workforce, reaching out to people who have lapsed certificates or licenses, finding ways to better hire people from across state lines. And we're working on ways to enhance the alternate care facility, which has 14 patients today, to further look at the admission criteria around how we can further care for patients. So all of these things together are working to address this surge in our state. But please remember, the most important way to address this is to prevent the patients from needing the care in the first place.
Thank you, Eric. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks for having this call. My question is for the governor. I understand that you're working on a new COVID-19 relief package, and I was wondering if you could share any details of what would be in that package.
Thanks, Molly, for asking. We are in the process of doing that right now, and so I'm reluctant to talk about anything specific, but we hope to have that done in the very near future. And it's our goal to also share that with the leadership of both houses so that we can actually accomplish some things. So the goal is, to get this done, and we hope to have it ready to share with others probably early next week or the middle of next week. And at that time, I will have a final list of things.
Thank you, Molly. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. I think this question might be best for the governor. Jumping back a little bit, to April, you and other governors, I think with about 6 other Midwestern states, had talked about collaborating, coordinating on COVID-19 response efforts. I was just wondering if you can kind of bring us up to speed on, what that's entailed. Have there been any major collaborations since then? Thank you.
Yeah, and actually I have a call with the Midwest governors this afternoon, actually. And we do talk regularly. We mainly talk about how things are going in each other's states, share ideas. We continue to work with them to get PPE in bulk that we aren't getting it from the federal government. So we do look at purchasing things together, but primarily we look at different strategies that work or don't work in each other's states and talk about how important it is for us to be together on these issues. And for the most part, we are. Other state governors still have ability to directly mitigate issues in their states where I do not in our state. But the collaboration that we have had and the conversations we have been part of have been very helpful. But I would say the main issues that we've directly collaborated and been uniform on is acquiring different levels of PPE, and also, frankly, making sure that as Republican and Democratic governors, we're continuing to encourage the federal government to make another contribution to help solve this problem.
Thank you, Mitchell. Now to Todd Richmond from the Associated Press. Todd? Again, Todd Richmond from the Associated Press. Okay, we'll have to move on then to Steve Elbow from the Cap Times. Steve?
Hi, thanks for doing this. I'm wondering if there's any data out there. I mean, let's say that the most of the state doesn't change their behavior, doesn't take this on, and things stay relatively the same at the current rate of growth of cases and deaths. Are there any projections about what the state might look like in terms of case numbers in a month?
So sure. Well, we shared some of those data in this forum earlier. The Institute for Health Metrics and Evaluation, University of Washington, projects state by state what the disease curve models would show under certain circumstances. One of the ways they do that is to say how things might be predicted to be different if there was universal mask wearing versus not. Without having the numbers directly in front of us, I think what the governor mentioned in his remarks was something akin to 2,500 additional deaths by January if current trends continue. The website, which is easy to use sort of state by state, also shows what a worst case scenario would be is if we did less than what we're doing now. So that was the prediction, potentially a doubling of cases and deaths by the end of the year.
Thank you, Steve. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hey, thanks for doing this call. My question is for the healthcare professionals. Here in Brown County yesterday, local health officials had mentioned that most of the case growth that they're seeing is happening in small gatherings. More people are being infected in small gatherings now than ever before. I was wondering, are you seeing the same thing on the state level? And if so, can anything be done about it? And if so, is targeting businesses with things like the gathering order, which is no longer enforced, is that even really doing anything to help the current situation? Thank you very much.
Well, let me start and then see what Dr. Westergaard would add to that. What we know is that COVID-19 is spread whenever people are within close proximity to each other. If they're in a small gathering in someone's home, or if they're around a restaurant table at a restaurant, if they're at work together. It doesn't matter the location, it matters the proximity of people together. And what we also know is that COVID-19 is really sneaky, because of its ability to spread when we don't have symptoms, either because we've got mild illness where we won't have symptoms, or because we're about to have symptoms in a day or two and we can still spread the disease. So it is the proximity of people who mix from different environments that is contributing to this. And because children are at home on online education, and because in many parts of the state, and because many people are working at home, many of those gatherings tend to be in people's homes now rather than out in public. So it is a variety of mechanisms that we take to discourage mixing of people from different environments together where they could potentially share asymptomatic spread that really drive those efforts. But let me turn to Dr. Westergaard and see what else he would add.
Sure. There have been some interesting studies from other countries that show that a large amount of the transmission in the community is a result of so-called super spreader events. So gatherings with larger numbers of people in restaurants, weddings, bars, those types of activities. So those events where a lot of people together can really seed other infections and really drive infections up. Those studies, interestingly, were in environments where the level of overall community spread was quite a bit lower than it is in Wisconsin. So while it tells you that those are sort of the highest priority to restrict larger gatherings, what we also learned, sort of the additional bad news about this virus, is that in small gatherings and in households, it's extraordinarily contagious. So some data from Wisconsin and Tennessee, just published a week ago, showed that the risk of a household member becoming infected, if any member of the household is infected, whether they're an adult or a child, is 1 in 2 within a week. So 50% of people, unless we're very careful, can be expected to get infected. So both are highly, highly important. We need to restrict large gatherings because that's how the epidemic accelerates. But we also need to really be very, very careful about avoiding not only small gatherings of other people, but getting tested and doing isolation and quarantine for people within households. So there's no safe gathering right now, unfortunately. Large gatherings and small gatherings, and inside the household, we have to be as careful as we possibly can be.
Thank you. Now to Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. I had a question with regards to how businesses might be able to have a place in this conversation around the impact of COVID on their businesses. Has there been any discussion around maybe doing something like a campaign around what that looks like? Because I know that a number of businesses in the Racine area have literally had to shut down entire lines because people are not following the rules.
Yeah, and I'll just jump in here. The WEDC has almost since day one been reaching out to businesses on our behalf, creating guidelines for businesses, giving businesses voice. Frankly, I spent a lot of my time early on in this pandemic listening to businesses, whether it's agriculture, whether it's in the tourism business, doesn't make any difference. We have listened to businesses a lot. We've provided millions and millions of dollars to small businesses in the state of Wisconsin, to farmers in the state of Wisconsin. So those conversations continue. But at the bottom line, I do remember one of the first conversations I had with a group of business leaders in the state, and what they are telling me, and this holds true today, is that people will not be good consumers if they don't have confidence in their own health and their own safety. So we continue to prioritize doing things to make sure that we corral this virus so that they will have confidence in their world and in their safety and their health, will buy and bring the economy back. That said, we will continue to reach out to businesses and we'll continue to support especially our small businesses with resources that they need in order to continue making sure that they continue going forward.
Thank you, Denise. Now to Terry Sater from WISN TV in Milwaukee. Terry.
Yes, good afternoon. Thank you for having this call. And this is really, I guess, for Dr. Westergaard. I believe you said that we're at a tipping point where hospitals may not be able to save everyone who becomes seriously ill. Where are we today, Dr. Westergaard, in that setting?
Well, I believe we're getting to the point where hospitals are strained and are likely to run out of staff before they run out of physical space. So hospitals, when they can't accommodate, when they can't safely care for the number of people in their hospital because they don't have staff or they don't have space, have to divert admissions to other hospitals or refuse transfers from other hospitals if they're a referral center. And we are very close to that being happen in certain areas. We've heard there are some hospitals that have no ICU beds available as of today. So it's a matter of degrees. There are likely areas right now where hospitals have to go on divert and cannot accept patients that they normally would. The concern is that as this becomes more prevalent, more widespread, there may be instances where people who have needs for emergency medical care that won't have a place to go in time. So that's the real concern of an overwhelmed healthcare system, is that the care that we deliver in close to people's homes in a timely fashion won't be able to be delivered. And I think there are right now some areas where that's a concern, but the trajectory is that we could realistically be there on a larger scale. And that's what we really need to strive to avoid by reducing the transmission in the state right now.
Thank you, Terry. Now to Katrina Nickel from WLUK in Green Bay. Katrina.
Hi there. Thanks for taking this call. So my question is actually about the announcement the UW system made this afternoon, talking about requiring students to be tested before and after their breaks. I was just looking to hear more from the health professionals about what they think about this and how the state's going to be able to handle all these students being required to be tested.
Well, I'll begin, and if Dr. Westergaard would like to add, the UW system has really set up an incredible testing system and has been very diligent about testing students throughout. And we've seen the success of that. You know, here at UW-Madison, we had a large number of students who tested positive when they first came back to school in the fall. And then the university continued testing. The key is the university also assured that every student who tested positive was isolated and their close contacts were quarantined for 14 days. So it wasn't necessarily the testing that made their curve go way down. It was the testing, the contact tracing, the isolation, and quarantine. So again, a test today, as the governor said in his opening remarks, means you didn't have COVID-19 at the moment you were tested. And it doesn't guarantee that you weren't exposed and couldn't test positive tomorrow or the next day. So testing is an important tool, but we need to continue to have everyone monitor symptoms and decrease their exposures to reduce transmission of this disease. So I don't know, Dr. Westergaard, what you might add.
Yeah, I would just emphasize that point because it's a really important thing. What the public health benefit of testing an entire population at one point in time is not to tell individuals that you're uninfected. It's not to be able to tell people it's safe to be in contact with others. The point of that is to find out who is infected so the people who have been in contact with them know that they are at risk. So if people have been in an environment when they were around people who have tested positive, or there's a high level of community spread, I'm thinking specifically about students going home for holidays and Thanksgiving. Someone who's been in that environment has a risk of developing the infection for 14 days. And a test, like Julie just said, tells you you're not infected right now, but it doesn't say that it's safe to be in close contact with others for 2 weeks. It's that issue about the incubation period of the virus. If I'm exposed today, if I test negative tomorrow and the day after that and the day after that, I could develop infection and spread the infection on day 4 or 5. And particularly if I'm around people who are at high risk, who are older, it could put them at a great deal of risk. the extent of the infection right now, but we only prevent infections when we use that information to get people into isolation and expose people to quarantine.
Thank you, Katrina. Now to Danny Maxwell from WKOW-TV in Madison. Danny.
Hi. I think this is probably mostly for the governor, but the latest White House task force report is kind of singling out Wisconsin again to adopt these mitigation efforts to slow the spread, which I know that you have tried to do. Has there been any outreach that you have done to the White House task force for help getting lawmakers or other groups on board with some of these mitigation efforts? And you talk about your new relief package. How confident are you that you will get Republican lawmakers on board with this?
Well, if you're asking me, well, first of all, I usually have that task force document right in front of me. I didn't bring it today. It's full of red. It is full of red. So in case anybody was wondering, yes, we're struggling as a state, and we struggle as much or more than most of the states in the country. And we have talked to, I remember just about a week or so ago, I had an opportunity to speak to Debbie Birx, Dr. Birx from the task force about that very issue. And they feel, they read what the responses are here in Wisconsin too. So, can they help? Possibly, but they also report to a president who, frankly, isn't the most consistent one as it relates to the things that count, masks, and make sure you're not in public gatherings with a whole bunch of people to spread the disease. So they're not going to play a huge political role here. I'm looking forward to having a discussion with the leaders of the Assembly and the Senate around what we can do, but they continue to be at least last time I heard publicly, they're not in favor of mandating anything. And that makes it more difficult, I would say.
Thank you, Danny. Now to Amanda from WAOW-TV in Wausau. Amanda? Amanda from WAOW. Okay, we have to move on then to Emily Davies from WSAW-TV in Wausau. Emily.
Thank you for taking my call. This question is for the governor, again, related to the legislation. Are you anticipating, we're seeing Republican governors putting more mandates. The Ohio governor is enlisting his, workers' comp investigators to help businesses be able to enforce mask mandates or mask orders in their businesses so that the 18-year-old clerk doesn't have to do it, is the word that the governor used this morning. Are you looking at things like that, and are you anticipating that those types of things, especially now with the election being over, that those things will be able to be used, or what are some of the things that you're looking at prioritizing?
Well, certainly we're prioritizing educating the public here. We tried that the other night, doing it today, been doing it for the last several months. And so at the end of the day, that's what it's going to be about, is educating the public, making sure they understand the consequences of not wearing a mask and not having distancing. Now, we are still working on pieces of legislation that we're going to share next week, so I'm not going to go into that now. We are also looking to work with our local public health officers to provide them with the tools necessary where they might be able to play a more aggressive role in this. But at the end of the day, we just need to have people understand the importance of the simple things that we've been talking about for the last 6 months.
Thank you, Emily. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben.
Good afternoon, Governor. My question is, at what point, if at any point, would you either strongly advise or somehow take action to have schools go all virtual statewide?
Well, we always are looking at that, but the the data around schools is not nearly as consequential as the data that we're seeing outside of schools. And so at this point in time, when schools get together with their local public health officers and they decide to go virtual, they go virtual, or they go virtual for a couple of weeks and come back. So it's not as if their schools are not taking the precautions necessary to keep the COVID-19 from taking over their schools. So I feel comfortable that it's still a place where learning can happen and that the disease can be kept at bay. And I also feel comfortable with the relationship the school leaders and the teachers have with local public health officers to make those decisions. Never say never in this world, but at this point in time, I believe that decision is best at the local level.
Thank you, Ben. And we have time for one more question this afternoon, and that belongs to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thanks for holding this. Just was wondering, the mask mandate expires in about 10 days or so. Are you planning to issue another public health emergency or looking to extend that? Thank you.
We're going to do anything in our power to make sure that people understand the importance of this, whether it's issuing another order, doing something similar to that at local level. But the people of Wisconsin have to feel confident that we will do everything we can to make sure that people are wearing masks and keeping socially distanced in the state.
Thank you, Sean. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.